class.
Sorry.
That's okay. That's okay. We offer classes and trainings with the CEUs for to help you renew your licenses. We encourage you guys to visit our website for all the resources that are available through the LCPR. We are sponsored by the OBH. We have Dr. Freeman, Leslie Freeman on the call. You guys know her. We thank the OBH for all the support. We have Dr. Harrison, that is our consultant that most of you guys know. If you have any questions and want to contact me about any trainings or any resources that you need, please feel free to contact me at any time. Dave is gonna drop the website on the chat room. Please, I encourage you visit the website. Thank you and enjoy the training.
Thank you very much, Paula. Thank you very, very much. I appreciate that. And everyone, thank you all for showing up. There are more that are coming in and populating. We will have one more session. I'm so grateful for your participation throughout this series. This has been a real honor for those on our team who have been able to pull and put this together for you all. We tried desperately to work with LCPR and to work with the state leadership to be able to make sure that we crafted something that was tailored to who you are, where you are, and the work that you all are doing. And so we hope it's been of some use and some value for you. We have one more. The next week's session will be focused on engagement with the faith community. I am really, really excited about the instructor that we will have coming on next week. I'm sure you will love him. I have no doubt about that. He is going to be an exciting trainer, and I think some of you may have already been exposed to him at some point in time, and so we're looking forward to that. So that's next Friday, I believe. And the timing on that one is slightly different. The timing of that is not going to be at the regular 9 a.m. time frame. The timing of that is going to be a little bit later. I'll find out and determine the exact timing, and then we'll make sure that we provide that to you also. But please look out for that, and please share it with those that you think are needing to be a part of this conversation. So I'm glad you all are here. I'm looking forward to the conversation that we're going to have today. And with that, if you don't mind, I'm going to go ahead and share my screen and kind of get started with this. And come on. And Dave, if you don't mind, if you can let me know whether or not you can share, you can see my PowerPoint, that would be terrific.
Good to go.
How's the audio?
It was choppy at first, but it's clear now.
Thank you very much. Folks, please, Dave, let me know whenever I get a little choppy. Again, I'm having some challenges on this end, but we're going to work through this. I want to just jump right in because I want Bessie to have as much time as possible to help me get through this today. God bless you all. God bless this virtual world that we are all in. Here's the thing. I've had the unique privilege of working in this field for more than 25 plus years. I stopped counting after 25 because it doesn't kind of make sense to do any more than that. And in the course of that, I've had the unique privilege of working with some of the leading thinkers and systems of help and support, some of the leading practitioners that this nation has to offer, that has informed how I think about the roles of prevention, treatment, and recovery. And part of what it is that I've been looking to do, at least over the last few years, is to bring that information to bear for those of you who are working in this field, to see if we might be able to change the conversation that we have been having in this nation. Change the conversation as it relates to some things that may not have received the kind of attention that I think is warranted, specifically during these crucial times that we're in. So today's training session is really about what are those conversation changing opportunities that we have as leaders and thinkers in the space of prevention, treatment, and recovery as it relates to how we might be able to help inform our communities with the work that we're doing. And so with that as a bit of a backdrop, I want to offer my thanks again to the LCPR and to the Office of Drug Policy and to all of those who are responsible for helping to make sure that we were able to share this information with you all, and we'll be able to gather. Throughout my session today, I'm going to encourage you all to put your thoughts in the chat and put your conversations in the chat and any questions that you have in the chat so that we might be able to engage with you there. It is perfectly all right to talk in class, so to speak. And so my great friend, Dave Clausen, who is my partner in this endeavor, will be with you all in the chat as well. And I see many of familiar names and familiar faces as we came up. And so I think everybody here is pretty much familiar with Dave and I, but Dave is an extraordinary leader in prevention. He is the co-leader of the Mid-America Prevention Technology Transfer Center. He oversees a consultant firm that he operates called DJC Solutions that focuses on providing help and support to those of us in this field trying to do what we do in an even better, stronger, and a higher caliber way as we are engaging with folks. I did want to let folks know that we are recording this webinar for use afterwards, and so the views that are expressed during this does not represent the views and the policies and positions of the Substance Abuse and Mental Health Services Administration, or even any of the sponsors of this particular training session that we are going to deliver. And so I want to just thank everybody for being a part of this and thank those of you who are here. I want to start with this thought. There are a number of you who I'm sure are familiar with the name Simon Sinek. If you do not know him, he is one of the leading thinkers in kind of provoking leaders around the country and internationally, quite frankly, at his level, to think differently about how they approach leadership. And one of the things, he produced a seminal book called Starting with Why, which is where most folks know him from. But what I will share with you is that one of the things that he stated really stuck and it really resonated with me. And it caused me to think a little bit differently about the way we have been conducting our work as prevention leaders. And he said, people don't buy what you do, people buy why you do it. And the thing that resonated with me is the fact that I believe that as prevention leaders, we are often really good at telling folks the what's that we do. You know, the 7 strategies of this and the 6 steps to that and the 5 phases of this. But we are doing not so well a job in position when it comes to how do we make sure that folks understand the purpose behind why we do what we do and how we do it. And so with that, I want to share with you what I believe, right? Which I believe we all share in this, What do we believe as preventionists? I think we believe three things. One, we believe that the most effective way of addressing a problem is to prevent it before it starts, right? Clear, simple. I'm a preventionist. We believe in the full engagement and empowerment of the community in their role to both understand and solve that problem, right? And lastly, we believe in being guided by science in order to achieve population level change, right? These are our core values as preventionists. This is what we believe. And as Simon Sinek says, is if we can find those who believe what we believe, we are able to engage with them in whatever it is that we are attempting to do. But what's the issue and what's the challenge that we find ourselves with? These are core values and core beliefs that I don't believe anybody has any issues or any problems with. But yet, and I will share this with you, I was speaking and delivering a keynote for the National Alliance for Drug Endangered Children. Many of you know the National Alliance of, or National DEC, and an extraordinary organization that does some remarkable things in terms of protecting young people around the dangers associated with drugs in communities around the country. And as I was doing such, the DEA released a report. This is some time ago. The DEA released a report that indicated that the opioid issue, which at that time was almost exclusively focused on the overprescribing of prescription drugs, was actually far worse than had originally been reported, right? And when you looked at the data associated with it, right, the data indicated by county that the number of pills distributed per person per year was at dangerous amounts in many of the counties across the country. The fact of the matter is as you're looking at this picture of the nation, anywhere you see purple is in trouble, and there's a lot of purple that you are looking at. But here's more to the point. Are we certain how and who we are prioritizing here in this environment? In the context of this environment, what are the messages that we are prioritizing? Who are the most vulnerable, and how are we protecting the most vulnerable? I started thinking about that, quite frankly, because I will share with you, in the last 4 years, my life changed dramatically. My wife and I became grandparents for the very first time, right? So 4 years ago, my son and his wife gave birth to our first grandchild, our grandson Ethan, and then 10 days later, my daughter gave birth to twins. And that's right, yes, if you're doing the math, that meant we went from 0 to 3 in 10 days. So I don't know how you all do it in Louisiana, but that's apparently in the water where I come from. So and then my son, because of who he is, he and his wife couldn't stand that his little sister seemingly was ahead of him. So they gave us our fourth grandchild, and within a year after that. So we have 4 beautiful, beautiful grandchildren. And anybody that knows this secret knows that if you're a grandparent, you know this, your world changes without question. The way you view the world changes without question. And so they became the most remarkable creatures in my life. And so what I began to do is, when I would go to my children's home to visit with my grandkids, here's what I find. I'm the grandfather. They call me Babu, right? Babu is Swahili for grandfather. They call me Babu, right? So Babu is coming, right? And when I show up, I'm expecting the heavens to open up and the trumpets to blare, and you know, because the grandfather is showing up. But this is what I find when I go into my children's home. I find that for the life of me, even though I have a couple of degrees, I cannot figure out how to open up this doggone thing to navigate the stairs. I don't know what's going on. And then what happens when I go downstairs and I'm looking for my snack? I can't get in the cabinets to get my snack. I don't know what's going on. I can't call anybody because when I call someone or try to charge my phone, I can't figure out how to charge my phone. And I don't mean to be rude or crude, but I will share this with you. There are some areas of the house that should never be restricted. I'm just saying that just up front, right? And so here's the point that I want to make here. In the chat right now, tell me who's the priority in this environment? Who's the priority in this environment? Is it me? Is it the grandfather? Who's the priority in this environment? Put that in the chat right now. And Dave, once they start populating, let me know.
The children.
Of course.
That was our first one. Keep them coming, y'all. Children.
Of course.
Thanks,
Wow.
Amber.
Right.
Grandkids. Right. Oh, here comes a waterfall.
There you go. So of course it's the kids. The kids are the most important. Is there any doubt who is the priority in this environment? Absolutely none, right? There is no doubt who the priority is in this environment. Can we say the same when we look at the context of this environment? Because here's the point that I want to make to everyone. Prevention is about identifying, sorry, come on, Betsy, work with me, honey, work with me. Prevention is about identifying the most vulnerable in our population, right? And identifying where they are most vulnerable, what environments make them in their most vulnerable case, across the lifespan. And most importantly, just like the gate at the top of the stairway, right? Prevention should be obvious. Prevention should be blatant. Prevention, in my view, should be intrusive, right? Because it declares who the most vulnerable in our population ought to be. And so as we are looking at this, what I want to share with you, if Bessie will help me out, thank you, Bessie. What I want to share with you is that as we are looking at prevention across the span of lifetime, there are things and areas that place our communities at real vulnerability, real risk, right? Whether we're looking at the maternal effects that are going on and being attentive to the maternal effects of childbearing women, childbearing age women, or we're looking at the issues and challenges that are often not observed with our older adults, right? There are areas that we need to make obvious on behalf of our communities. And I have a weird disease. I go around and I read the strategic substance abuse strategic prevention plans of about every state, right? And so yes, indeed, I read your strategic plan, which is voluminous, right? You all have a really thorough plan that you should be proud of, that really takes into consideration all of those who are working within that plan. But part of what it is that I appreciated about the plan that you have in Louisiana is that you are really intentional about addressing these areas of vulnerability across the lifespan. You are making sure that in a real sense, you're trying to make prevention obvious in really, really clear ways, right? And so whether we're talking about the great work that's being done throughout the administration in the efforts of the Drug Policy Board by those such as the Louisiana Board of Pharmacy or the National Guard, or and all of the other players that are involved with that, or the fantastic work that is being done through the Louisiana Partnerships for Success. And I think there's a old friend of mine who was a former colleague of mine who is working and helping you all with that. Christy Miller, if you see her, give her a hug and tell her I said hey. Or extraordinary, remarkable coalitions like the wonderful coalition in the Gaudier Initiative, and those that are doing some phenomenal work there in Jefferson Parish, and the work that they are doing through their DFC support and great work. All the work that you all are doing through the LCPR and our wonderful hosts today at the Department of Behavioral Health. You all are working across the state, building bridges of connection. And the important thing is that what you've learned very, very clearly is that there is an important time that we're in where public health and criminal justice have to be considered together. And you are looking at the fact that prevention is the cornerstone of that bridge. And so as we are looking at this, hold on a second. Dave, are you still seeing my slides?
Yes, we're seeing the public health and criminal justice bridge slide.
Thank you. As you are looking at this, what I want to share with you is that as Dr. King offered, and you guys forgive me, I'm going to work through this as best I possibly can. As Dr. King offered, we are living in some fiercely urgent times, and this is really the point of the message that I want to offer. We are living in some fiercely urgent times, which means that our nation is currently in a conversation that is looking at the opioid crisis, but not merely the opioid crisis. We are working in a community or in a society that is dealing with addressing the issues of marijuana legalization that's happening across the nation, hallucinogens that are being, that we're asked to think of as medicine. There are new psychoactive substances that are coming from across the waters that are entering into our societies like bath salts. And many of you are very familiar with the fact that we are now having to deal with synthetics that are mixing with things like cocaine and meth that are on the rise in our communities. And how many of you will recall that at one point in time, we were very, very focused on the vaping crisis in our country. My point of showing you all of this is the fact that we were dealing with a huge number of issues, very complex issues in our society, making our society vulnerable. And then COVID happened, right? We were dealing with all of that. And then the pandemic occurred. And as the pandemic occurred, what the pandemic resulted in is actually exacerbating the issues. There are those of you who are listening and know this for a fact that we were beginning to see some improvements and progress being made. The numbers of overdose deaths that were occurring were actually beginning to level out, that have now taking a spike in the wrong direction. We have, unfortunately, regrettably this year, more than 90,000 individuals within our country who have died from a drug overdose. That's 20,000 more than what was recorded last year. And that is that because regardless of what the vulnerability happens to be, and we were dealing with all of these vulnerabilities. But what this pandemic has done is it's put a spotlight on the vulnerabilities in which we are engaged with. So regardless of the vulnerability, whether it's smoking marijuana or alcohol or those that are living in recovery, that are in need of continuous help and support. Whatever the vulnerability is, this pandemic has put a spotlight on it and put a spotlight on those populations that are the most vulnerable. And in fact, SAMHSA, the Substance Abuse and Mental Health Services Administration, released a report recently that showcased the fact that we are paying attention to vulnerable environments, which indicate to us that as preventionists, we need to be able to expand our vocabulary. We have now found that we have to consider things like behavioral health disparities. Well, what does that mean for us as those who are working in prevention? Well, that means that we have to, as we're thinking about our strategies, we have to also think about the fact that there are those that are experiencing differences in outcomes and differences in access to services as we're looking at who they are in our communities, right? And so we know for a fact that COVID-19 has put some members of our population at higher risk of opioid overdoses. But what we may not be looking at is the fact that part of the reason that has happened is because an existing disparity, an existing vulnerability is now being completely exploited by the pandemic. If you're looking at the chart, what you're seeing is that African Americans and Hispanics are accessing substance abuse treatment support and services at half the rate as the overall population, right? And in addition to that, we are looking at the fact that increasing data shows that drug deaths among Blacks in urban counties are far outpacing every other racial or ethnic group when it relates to the opioid crisis. And the conversation in our country hasn't been clearly as much on that aspect. And so these are vulnerabilities that we have to attend to and contend with. Part of where this conversation is coming from is that I had the unique and extraordinary privilege of working with the Drug Enforcement Administration in cities across the country and helping to engage communities in this conversation around the opioid crisis. And part of what I found is a very interesting and very unique issue. I'm going to show you this article of a county that I had the ability of working in. This happened immediately after the DEA came out with the report showing and indicating the dangers that were associated in our counties. And so this county prosecutor, one of the leading law enforcement officials in that community, decided to convene a meeting to discuss this and bring up this importance to this community. And can anyone look at the picture? You know I've been living in Washington, D.C. or near Washington, D.C. for far too long because I've started redacting everything. So don't worry about that. But if you can look at the picture, can anybody tell me what's wrong and what you perceive as being wrong in this picture? You could just put that in the chat. And Dave, when they start to populate, just let me know. What is wrong in this picture?
We've got them thinking this morning.
Can anybody tell me what's wrong that you perceive as being wrong in this picture?
All right. Not inclusive. No Black folks. No diversity.
Good.
No diversity. Seeing a theme here. They're picking up on it.
All right.
Only women. No mask.
Well, this is before the pandemic. This picture was taken before the pandemic. But what I will share with you is, what about all these empty chairs, right? And I agree with you with respect to the diversity picture. And it's actually worse than that, because I can tell you that this woman right here in the front actually works for the guy that's speaking, right? So it's actually even worse than what the picture is indicating. But what I will share with you is that part of what has come to light and come to my attention is that we have to have a new kind of conversation. And that conversation has to be about engagement. What is it that we are doing And whose responsibility is it to ensure that the folks understand the importance and the urgency of the times that we are in? I will share with you that it's not the responsibility of those that are not in the seats. It's the responsibility of those of us to be able to have a different kind of a conversation to allow them to engage with us where we are. And so I want to offer you the fact that I believe that we can have a different kind of conversation, because part of what it is that we have all been really good with is the fact that we've been, oh my gosh. Folks, I want to apologize. I am dealing with some really huge technical difficulties here. I'm going to try to go through this in a way that allows you all to get the information that I'm trying to share. What I want you to see with this particular slide is the fact that this is what we all have been charged with doing. You all have been charged with conducting a public health model approach. We know the importance of identifying the problem. We know the importance of looking at our risk factors and protective factors and defining our environments, and the importance of identifying and developing a comprehensive set of strategies. But where we aren't doing as good a job, and where I'm suggesting that we have to begin to focus on, is that last step in the public health approach, which is assuring widespread adoption. Meaning, in other words, how do we go beyond the usual suspects? How do we go beyond ourselves to bring in the broader population into this conversation? And I'm going to offer you that there are, I think, 4 key engagement vulnerabilities or opportunities for us as prevention leaders that I'm going to spend the remainder of our time talking about. 1, communicating clarity as I think an important vulnerability that can turn into an opportunity for us. 2, confronting commercialization and marijuana myths in these current times that we're in. 3, looking at the relationship between polysubstance misuse and the untapped potential of youth leadership. And lastly, how can we ensure that we are engaging effectively and equitably? The first one of these is communicating clarity. And as we are looking at this, I want to offer you a little bit of a test, if you wouldn't mind going along with this. What I'm going to ask you is in the chat, oh, gosh, help me, Lord, help me, Lord. In the chat, all right, there you go. In the chat, if you, forgive this, everybody. I am so remarkably sorry. In the chat, if you wouldn't mind, could you let me know which way you think the cat is going?
While they enter their responses, I'm going to send Bessie some positive vibes. Come on, Bessie.
Thank you very much.
All right, so we got a nice little chat, little waterfall, up, up, down, up. It's a toss up. We've got some folks saying both directions.
I thank you all for participating, and Bessie's going to help us through this. We're going to be okay. We're going to be okay. Here's the deal. The cat's going whichever way we decide it wants to go, right? And the reason I use that slide as a way of helping us to think about this is because I want you to look at this particular graph and chart right here. What you're seeing here is the percentage of high school seniors reporting past substance misuse, right? Regardless of what substance it is, the red represents alcohol, purple represents cigarettes, the green represents marijuana, and then you have other illicit drugs. What I want you first to look at, right, is that this is going over a large course of time from 1975 to 2016. And actually, I have data now that goes to our current point. But what I want you to look at is I want you to look at the trend, right? The trend. And if you're looking at the trend from the earlier years of the mid 70s what you're seeing all the way to today's time, you are seeing a trend that's going in a downward direction, which is a very positive direction, right? We are seeing that the percentage of high school seniors reporting past substance misuse is a lot lower today than it was a couple of decades ago, right? Which is a huge success. The only exception to that positive trend is the green line that you'll look at, marijuana, and we're going to talk about that in just a moment. But overarchingly, we're seeing a very positive trend here. I'm going to show this in a different way, right? Here you're looking at the same group of high school seniors, and over the course of the same time, except this one goes further to today's period, and this is the question of how many of our high school seniors are reporting no use of alcohol, cigarettes, or marijuana. Actually, it's the inverse of the last slide. And what you're seeing is that this trend is going in a very positive direction. You can see here for past 30-day non-use being from a low of somewhere around 17% to now is up over 59% of our high school seniors saying that they are not using any illicit substance, marijuana, cigarette, or alcohol in the past 30 days. That is remarkable achievement in the work that all of us are associated with and doing. But as we look at this really extraordinary data that shows us how we are having some really positive impact for our young people, those vulnerable in our society, I would like to share with you that much of the conversation and the dialogue that we have been hearing, whether it's in the media or whether it's on social media, we are hearing nothing but the failure of this thing called the war on drugs. Now, I'm not here to litigate the war on drugs or the phraseology of the war on drugs. What I am here to say is that the great work that you all are doing is having extraordinary impact and extraordinary success with our most vulnerable population, our adolescents. And these are trends that we have to keep going. If you don't get anything from this message, we have to continue to do this. But why is that message not being heard clearly across our society? I would ask you in the form of a question. I just simply want you to put in the chat if you can, answer this question and follow these instructions. Gina Lakanani Tafadali, right? And don't worry if you begin to struggle with that. The reason why many of you probably are not able to do this is because this is the language Swahili. I've had the privilege in my family. I'm the first of my family to be able to go back to the continent and spend a significant amount of time. This is Swahili, and it simply says, put your name in the chat, please. That's all this is asking you for, right? But you couldn't probably participate in that. Why? Because you couldn't understand the language that was being offered. Here's the point I want to make here. I go from community to community to community to community, and there is no shortage of people who care desperately about the work that we are doing, who care desperately about the issues that we care desperately about, and who want to urgently engage with us to help us to do that work. When they come to us, though, here's what we say to them. We say, oh yes, you can do that work, but you have to be able to know the strategic prevention framework, which is a 5-phase process. And if you like the strategic prevention framework, you also need to know communities that care. And if you like that 5-phase process, we have another 5-phase process called collective impact, right? Which needs a backbone organization. But if you're going to do any of that, you need the social ecological model and understand the social ecological model. But the social ecological model means nothing unless with young people, you understand the social development strategy. And that social development strategy also requires a community asset-based development process. And if you have that community asset-based development process, you need to know the 40 developmental assets. And the 40 developmental assets has to have a social investment strategy associated with it. And that social investment strategy has to be informed by the social determinants of health. And if you have the social determinants of health, then you have to have health in all policies. And if you have all of that, then all of that, I would suggest to our communities, sounds a lot more like Swahili than it does prevention science, right? And so here's the point that I want to make for all of us, right? All of these tools are vitally important, right? All of these tools suggest that we must be able to do our jobs better. We now know more in prevention than we've ever known in the history of the work in the field that we are in. Yet, this is similarly to I like a good garden, and my neighbor has a beautiful garden. And when I look at my neighbor's garden, I look at the tools they're using, and I go to Home Depot and I buy those same tools. But how many of you know that when I come back, my garden still doesn't look anything like my neighbor's garden, right? It's because it requires more than the tools. And what we have to understand is the prevention is more than a science. Prevention is a craft that we can get better at, a craft that we can improve in, a craft that requires some skill set. And part of the challenge that we might be having as we are articulating the science of prevention to communities that we are working with is something that my good friend Ivan Juzang, who was the presenter for the last session, helped us to understand. When you're trying to engage many in our community, we have to understand that many of our cultures have an oral communication culture, right? We are storytellers as opposed to a literate-based communications culture, right? And much of the time we are trying to articulate this literate-based process and framework and strategy to oral culture, oral communication-based cultures. And they're having a hard time understanding where and how they fit into that. So that's one message that I wanted to share with you that we need to take into consideration. And so the role of prevention for coalitions, that I think if you're going to apply prevention science, as we're applying prevention science, is to focus on four things. These are the four things that coalitions ought to be doing well, right? We ought to help our communities translate and clarify. What do I mean by that? We use prevention science to help us to prioritize. Next, we need to help our communities focus locally, identify what are those conditions that are existing in our specific location, take it from the amorphous, take it from the generalizable, and concretize that for our unique location so that we might be able to address that. Then we're able to define our strategic leverage by aligning strategies that help us to have an impact on those local conditions. And if we're going to do all of that, we have to more effectively communicate and engage, but we have to do that from an equitable framework when we're thinking about that. And I'll talk about that in a little bit more as we get into that. The last point I want to make about this whole clarifying prevention from our perspective role is that we, I believe, are living in a point where we need to reframe the way we are thinking about prevention in order to meet our current crisis, right? Preventionists ought to be engaged with and supportive of course, training how to administer Narcan, looking at specific harm reduction efforts and how we might be able to do this, because we ought to be about preventing overdoses. We ought to be about preventing deaths that are occurring in our society, right? Overdose prevention needs to be a part of the conversation that we have. We also have to work more closely aligned with our treatment and our recovery partners in prevention, right? Far too long have we been operating in silos, but we want to think about prevention in a way that helps those partners to understand how they might begin to prevent the relapses that are a natural part of those that are living with the issues and the lifestyle of recovery. How do we help them redefine success, not as a 3-month treatment program or a 6-month treatment program or a completion of a 9-month treatment program, but rather redefine success in a way that defines success as long-term sustained sobriety? And how do we help provide support systems around those to be able to do that? That's relapse prevention. But I want to focus my attention, the remainder of my remarks, on the third element, which is where many of us are, and that's around primary prevention. And I believe that the clarity that's necessary in primary prevention is what's the goal of primary prevention? The goal of primary prevention is not to prevent all use by all people, right? We're not prohibitionists, but the goal of primary prevention is about the preventing of a disease of addiction. And if we can understand that 9 out of 10 adults who are living with the disease of addiction will share with you that their first engagement and encounter that has led to problematic misuse started when they were young teenagers, we get the vital importance of focusing on primary prevention that would prevent young people from engaging in this behavior in the first place. And so we have to articulate the goal of primary prevention as the prevention of addiction. The second conversation changing opportunity that I wanted to get into was this relationship between marijuana, commercialization, and polydrug misuse, and the way that all interacts with our untapped potential for young people to show some leadership. This is a chart, and I can easily replace this with the last year's NISDA survey results, which shows practically the exact same thing with a slight increase in marijuana misuse that's showed here. But that top bar is showing you marijuana misuse by those that are 12 years of age and older. And the major point that I want to make here is that we all get the fact that marijuana misuse is increasing in these recent years. The data that I'm getting ready to share with you has been collected and compiled and offered by some remarkable heroes of mine, Dr. Bertha Madras, Dr. Robert Dupont, and Dr. Caroline Dupont, all of which I've had the privilege of working with and have shared with me their approval of me sharing this information with you because they think it's so vitally important for the country. What I want to share with you is what they did is they looked over all of the NISDA data and all of the monitoring the future data over the last number of decades. And they asked two questions. They asked, is the use of any one substance by adolescents associated with increased risk of using any other substance, regardless of use sequence, right? And I'll get to that in just a second. And then they asked the inverse of that question, is non-use of one substance associated with decreased risk for using other substances? And what they found out is remarkable. Now, I'm going to only show you data that's relevant to marijuana because I want to have a conversation about marijuana. But what I'm sharing with you is something that shows up regardless of whether they ask the question about marijuana or alcohol or cigarettes or other illicit drugs. This same pattern shows. What they showed here, and I'm going to give you a second just to kind of acclimate yourself to the graph that you're looking at, but what you're looking at here is past month marijuana use that is associated with the higher use of other substances, right? Other substance misuse for young people between the ages of 12 and 17. And what you see here is the red represents alcohol, the blue represents binge alcohol use, the yellow is heavy alcohol use, the purple is cigarette use, and the dark blue is other illicit drugs. And the only thing that I want you to look at is the left side and the right side. On the left side, you see where those young people who said, no, I have not used marijuana in the past 30 days, what their level of use of those other substances were. Very low. Where they said, yes, I've used marijuana in the past 30 days, what you see here is a dramatic increase in the misuse of those other substances, right? And so merely what this is showing and demonstrating to us is that the association of their use of marijuana is highly linked to their association of misuse of other substances. And the inverse of that is true. And then SAMHSA, the Substance Use and Mental Health Services Administration, began to ask that same question of all substances. And again, I'm only showing you the marijuana question, but it shows here where the red indicates where there is no past year marijuana use. The blue indicates where there is any past year marijuana use, in other words, some experimentation. And the green represents where there's past year almost daily marijuana use, right? Which is an increase of marijuana use. And what you see here is whether the substance that they were looking at was opioid misuse or heavy alcohol or cocaine or meth. Where there was an increase of marijuana misuse, you also saw the strong likelihood that there was also an increased misuse of the problem behavior. But it's not merely substances that is at issue here. Also, when we looked at the mental health and mental well-being data that's associated here, this is major depressive episodes by young people 12 years of age or older. The other is serious issues of mental incidents that are also shown. And what you see here is that the more the usage of marijuana increased, the higher the likelihood that you are going to have a more prominent issue or challenge here. And again, this same information is true whether I was talking about marijuana or alcohol misuse or cigarette use or other illicit drugs. The whole point being that it's not about any singular use, it's about polydrug or polysubstance misuse that we have to begin to contend with. It's not about playing whack-a-mole and saying, okay, today we're looking at opioids, tomorrow we're looking at vaping, and tomorrow we're looking at meth or cocaine. It's about conveying a very singular message to our young people that all substance use or misuse is problematic and highly relevant to their increased participation in other substance misuse. Part of what it is that we also have to contend with is in this current day, the increased opportunity of commercialized recreation, commercialized marijuana, and as Dr. Dupont puts it, commercialized recreational pharmacology. And what I use here is an experience that I had. I was walking in New York City, and I came across a lovely, colorful truck that was playing some really loud music to get some attention. It had a window in it, and this lovely young lady stuck her head out, and it sort of was reminiscent of, remember the ice cream trucks that used to come in the neighborhood that would play the music. I don't know who you all have down there in Louisiana, but up where I lived, there was Mr. Softy, and I remember, to this day I can sing the Mr. Softy tune. I heard that tune and I came a running, right? Well, this is not selling ice cream. And in fact, when this lady stuck her head out, here's what she said to me verbatim. She said, "Hey guy, don't be shy, come get high. I got your gummies, I got your candies, I got your lollipops. Don't be shy, come get high." I looked at her and I just said, "Can I take your picture?" And here's the point that I want to make. One, yes, it is still illegal to sell any thing that has a THC value that would actually get anybody high. So they're actually selling a lie here. This is they're not selling you anything that would actually get you high if you buy anything from this young lady in this truck, right? They're very, very careful about that. But how many of you will agree with me that getting people high is not the purpose of this truck? Can somebody tell me in the chat what you believe the purpose of this truck really is? And I'm just going to give you about 30 seconds to do that. In the chat, what's the purpose of this truck?
All right, well, we'll wait for the responses. We did have a comment from Dylan saying that that's scary stuff right there.
Yeah. What's the purpose of this truck, everybody? Thank you.
Normalizing.
Absolutely, absolutely right. It's normalizing. They're wanting to normalize this. How many of you will agree with me that some 10 years ago, 15 years ago, that a site like this would have been unheard of, even in the streets of New York, right? It's about normalizing this behavior, because here's a key point that I want to make here. Normalizing makes the visible invisible. Normalizing makes the visible invisible, right? It's like that thing that we no longer see it. Folks are walking by this every day, it becomes a normal part of our society, and we no longer begin to actually see and respond to this, right? If you don't hear anything else that I'm saying today, and this is the point of this session, the job of prevention is that we make the invisible visible, right? So if normalizing makes the visible invisible, the job of prevention is to make the invisible visible or obvious, right? Obvious in a way that people can make good, appropriate, and adequate choices about what it is that they're saying. It is the reason why my children, my daughter, put a grate at the top of the stairway, right? Because that is an invisible, typically invisible vulnerability that she had to make obvious so that adults and children and anyone that encounters that vulnerable space has to make a choice and decision about it, right? That's the role of prevention, because commercialization is really what's at odds here, right? The conversation that we're having in the nation shouldn't be about this, but rather about this, right? Because the fact of the matter is that there is a huge, huge difference. And that difference that I'm speaking about is on 4 levels. 1, there's a difference in potency that we have to make obvious and visible for our communities to make appropriate choices and decisions about, right? Retail marijuana today is not about the natural plant, all right? It's not about how natural it is. It really is about the fact that 20%, 21% of all sales in some states have more than a 70+ THC potency associated with it, right? 2, it's about the delivery methods, right? All the science suggests that when you alter and you change the methods of delivery, that usage goes up, and therefore misuse tends to go up. And so we're not merely talking about this, we're talking about blunts, we're talking about edibles, we're talking about drinks. We're talking about all manners of things that we did not have to contend with a number of years ago, including the high vulnerability that our youth are finding, because we're seeing increasing cases where those electronic devices are being employed to use some of these products. And then lastly, we are all familiar with the dangers that have been associated with the mixing of synthetics, right, that are occurring in all kinds of ways, where fentanyl is getting mixed into folks who think that they're just simply buying marijuana. And there's a lot of things that are kind of going on with respect to the synthetic aspect of this conversation. The point being is that there is a vulnerability in the commercialization that's happening that should counter the myths that our young people are getting about marijuana, that I believe need to be made obvious and blatant so that we can do that. 2016 to 2019, we've seen 915,000 more individuals with a marijuana use disorder, right? That is huge, right? And you can see here, as you acclimate yourself to the chart, whether I'm talking about the age group of 12 to 17, which is 115,000 more, or those that are 26 and older, which is 500,000 more, there is huge implications that are happening in our society that we are now beginning to capture the data on. So some important considerations after I've had this conversation with you all, as we are thinking about this, it is very important to remember that, of course, not all substance use transitions to problematic use, right? There's all kinds of evidence that support that and suggest that. So we're not indicating that just simply by engaging, you will have a problem and have an issue. We have to be careful about that. And that the development of substance use disorder results from a complex set of interactions, whether it's genetic or environmental. Some of them are occurring in our family context, our family environments, others in our peer relationships and the like. There are other things such as mental health comorbidities that we have to also take into consideration. So I'm not trying to paint an overly simplified question or a picture for us. We have to acknowledge the realities as preventionists, but we need to understand that our young people are at vulnerable or in a vulnerable state when it comes to the issues around commercialized marijuana, which is why Dr. Dupont and the Institute for the Behavior and Health has promoted this incredible campaign that I'm hoping some of you have heard about. If you haven't, please look them up at IBH, and it's called One Choice. And One Choice is simply about us as prevention leaders clarifying the message. So regardless of all the strategies that we may be utilizing, regardless of all the frameworks and all the efforts that we are conducting, the goal of them all should be one clear message, that the goal of youth drug prevention is for young people to make one choice: no use of any alcohol, nicotine, marijuana, or other drugs for reasons of health. This is for young people under the age of 21, so that we might be able to be in alignment with our current national law, right? That's a very clear message. And when we begin to associate all of our work around supporting that message, it becomes really clear, really evident what the role of prevention ought to be in our society. And the best communicators of that message, I'm gonna tell you right now, is not me. It's not even many of you, I'm sorry to say, but it has to be our young people, right? How many of you will agree with me that our young people are the most powerful in engaging with this? Dr. Harrison, I believe, may be on and hearing this presentation. I had the privilege of going with her to visit one of the prevention efforts that she helps to provide some support to. And she introduced me to a number of incredible young people who are being trained about how to carry the prevention message in their communities to their peers. How many of you will agree with me that those young people know better how to speak to their peers than we do? They are much more adept. If you do not know the latest TikTok dance, you are not qualified to do this work with our young people. I'm just sharing that as a fact, all right? So I want to indicate that to you, and I want to go to this last point, and then we're going to bring this to a close. I talked about clarity in our messaging. I talked about the need for us to understand the importance and the relevance of commercialized marijuana or polysubstance misuse, and the importance of engaging our young people. I need to spend just a moment talking about equitable engagement. First, I want to clearly define what I'm talking about when I'm speaking of equity, right? Up at the top portion of this picture, you can see a number of folks with a various points of needs, right? But if we are dealing with all of them the same equally, which is what we tend to do as a society, right? We think about being fair, we think about being equal, we provide everyone with the same resource. But you can clearly see at the top level of the picture how that is inappropriate for many, right? But if we look at the bottom portion of the picture, we can see here that by focusing on the unique capabilities and vulnerabilities of our society, that we might be able to provide the appropriate resource and the appropriate level. This is what equity is really talking about. If we are going to engage our communities in an equitable approach, we have to do what my dear friend, Dr. Cerise Hunt, out of the University of Colorado, she was our first speaker. If you remember in our session 1, what she introduced to us is the importance of all of our considerations with all the work that we do. Now as preventionists, we have to ask a series of additional questions. Are we ensuring that the work that we're doing is valuing all individuals and populations equally? Are we making sure that we're doing that in a way that recognizes that there are some historical injustices that we as preventionists need to educate ourselves on if we're going to appropriately engage with some of our communities? I remember when much of the resources that were coming down from the federal level to support addressing the opioid epidemic, when it first became really on the radars of everyone, but the conversation was primarily about white males between the ages of 18 and 55, and it was all primarily around the misuse of prescription opioids, right? Well, we would go into some communities, particularly communities of color, and they would look at us and say, wait a second, I don't know what you're here for, but that's not us. And you're not talking to me, you're not talking to us. And in fact, when you were talking to us, you weren't coming out here offering any help, you were locking us up. And so part of what it is that we have to understand, even from our role as helping systems, is how we have to educate ourselves to better interact, relate from a point of an equitable engagement standpoint, right? And lastly, to make sure that we're able to appropriate all of these resources according to need. These health disparities can be eliminated when we achieve equity, right? And this is the goal that we should be having. So I'm here to share, and Bessie seems to be operating and cooperating now that I'm at the end of the presentation. She is like, I am glad you are almost done. Here's what I'm sharing with you. Everybody should have the privilege of meeting their heroes, and I've had the wonderful privilege of meeting one of my most important heroes before his passing. And many of you recognize Congressman John Lewis, and you might recognize the quote that has become almost synonymous with his name, right? This quote of our being able to get in good trouble. But here's the point of it that I think is most relevant for us. He shares that ours is not the struggle of a lifetime, or maybe even many lifetimes, but each one of us in every generation, all of us, has to do our part. And what that means for us as we are thinking about this is the fact that there are some very concrete things that we can do in doing our part. Number one is to recognize that part of what it is that we are trying to do is communicate one very, very clear message: a prevention of all use of any drugs during adolescence. In other words, how can we engage more young people in this one choice message, right, that Dr. Dupont at the IBH is trying to communicate? Two, we have to educate ourselves in a way that we're able to challenge myths and educate the realities of commercialized marijuana and other polysubstance misuse, right? This is not about legal or illegal. I'm not trying to get into that debate, right? Every community can have that debate on its own. But as preventionists, I have an accountability to be able to make sure that my community, my society is educated about those myths and about the realities that we are incurring. We have to think about those issues and challenges that are more pronounced for women of childbearing age, and engage. All the signs suggest that when we engage parents and parental figures in this kind of conversation and get them on board with the disapproval of substance misuse for young people, that has a direct impact on those young people as well. So we can do that, and we can do all of these are ways that we can help make prevention more blatant, more intrusive, and more obvious as we go through this process. And so, as we are looking throughout the continuum, many of you are providing support and services throughout this continuum, and very much we have, for a long time, been operating kind of separately in silos. In Louisiana, you have taken it on because I saw it written into your strategic plan. You have been proactive about how you might be able to bridge those gaps, right? Bridge those relationships. And as you're doing so, I just want to share and express my appreciation to all of you who are indeed doing that. I want to end on two notes. The first is this work is hard. This work is often thankless. It's often unnoticed. I will share with you first and foremost that for the work that you all are doing, that you are indeed being seen. And Your work is indeed having impact. And I, for one, thank you for all that you do. But we have to be careful about making sure that we care for ourselves and about ourselves with respect to this. And so Dr. Michael King, who is the regional administrator for Region 4 for SAMHSA, shared this with us once, and he's given me permission to be able to do the same. And so this is just encouraging us to create a personal resilience plan for ourselves as we are engaged in this work. And so I want you to identify one resilience skill or strategy that you would like to develop, that you can develop, that you're going to commit to developing after we get off of this session and throughout the remainder of this week and into the weekend. Choose one, and if you wouldn't mind, go ahead and share it in the chat. Just share one of these that you think has some real value for you, and I'll give you about 30 seconds to be able to do that. Dave, can you give me a time check?
It is 10:15.
Thank you. And are you seeing
All
any?
right.
Are you seeing any in the chat?
Yes.
What do you
Got a
see?
bit of optimism.
Yes.
Pray every day. Personal goals.
Good deal.
Number
Good
10,
deal.
sense of humor.
Without
Faith
question.
and spirituality. A couple of those.
Those are all good. Those are all fantastic. Those are all fantastic. I had to take a mental, what I refer to as a mental wellness day for myself yesterday. To be very honest, I only took half of the day to do it, but I took it. I took it. And I just had to take some moment to be able to look at my faith, look at kind of what I'm doing, and just kind of re-center myself a bit. And it had a very positive effect for me. And so I just offer that for you. I'm going to end on a couple of notes. Here you go. The first is, and folks, I do not get one dime. I want you to know I don't get one dime from sharing information from any of the individuals about any of the individuals that I had the privilege of either working with and being able to offer some of the great information that they were able to collect for us. But these are two books that I highly recommend if you are indeed looking at building your capacity in this field at this given time, right? One is it just came out. Dr. Kevin Sabet, some of you know him. He's become one of the leading voices in our field, addressing the marijuana industry and addressing the issues and the challenges associated with commercialized marijuana, recreational marijuana, and the impacts that it's having on our society and the like. Extraordinary information. It allows you to draw conclusions for yourself, but it is filled with remarkable information and data and support for those of us who are understanding the importance of understanding that there are a number of myths out there that have to be confronted and contended with. The second is a book by a hero of mine, Dr. Bob Dupont, who I mentioned. Robert Dupont was the first administrator of NIDA, the National Institute for on Drug Abuse, and he was the second drug czar for the nation. I had the remarkable privilege of being able to be a colleague of his and working with him, particularly in recent years, around the great work he's doing. He is remarkable. He continues to give of himself to this field, and he developed, or rather wrote this book, Chemical Slavery, Understanding Addiction and Stopping the Drug Epidemic in Our Society. It provides in-depth, remarkable information about what preventionists ought to be utilizing and thinking about as we are going about the work that we do. So I offer those two for your consideration. Here is our information for you to be able to access us, but all you got to do is go to Miss Paula or Dr. Harrison to be able to do that. But I just want to offer you all my sincere thanks for who you all have chosen to be, what is it that you're chosen to do, and how you've chosen to do this in this field. I thank you all for your time, and I am going to tell Betsy she did a remarkable job. Thank you, Betsy. And I'm going to allow Betsy to get her rest, okay? so we can now actually have a conversation and a talk. All right, forgive me, y'all. I appreciate for who you all are and how you all have been. Thank you for working with me as we tried to work through that conversation with you all. But I'm open to questions that you all might have at this point in time, and we can kind of move forward with respect to that. So with that, if there are any thoughts, any questions, please offer them up right now.
I would just like to make a comment, Carlton. You
Yes,
did
ma'am.
an amazing job. Thank you for all these other people that you have brought to us over the series, but you do a tremendous job. So thank you. But you know, one of the things I want to make, I like that idea about one choice. You know, I admired TFL for saying, don't smoke. They had one message. And it seems that those of us in prevention, we aren't as clear cut in terms, because we'll say, wait until you, I mean, it seems like we're saying, wait until you're 25 and it's okay. And so I really, truly like that message of one choice.
Thank you for sharing that. And the reason why it's important, and I thought it would be important to share with the state, is because it's something very simple. It doesn't cost a dime, right? And there are a number of communities that are employing it across the country, right? There are a number of coalitions that are finding ways of employing it and utilizing it. I would suggest to connect with, and I can help to do that if you are interested, but I'm very sure that Drs. Dupont would be very much open to having a conversation about how to apply, and there's some tools that you all might be able to utilize. But the important thing is to understand the message, but then give that message away to the young people and allow those young people to take that message forward, because they know how to do it in ways that are so creative that there is absolutely no way we could get in the way of it, right? Which is what we want to do. Thank you very, very much. Any other thoughts? Any other thoughts or questions?
Rusty, did you have something? I saw you come off mute.
No, I just wanted to make sure I said hello to everybody. And it's good to see y'all. And one day we'll be back in person, you know?
Carlton, this is the John Boy moment.
I hear you. Well,
hey, one thing though, with the messaging and all, that's exactly right. One of the things we're trying to do is to maintain that consistent messaging, you know, and we've really centered everything around the life's full of choices, choose wisely, right? So everything's based on the choose wisely type of, I don't know if you'd say marketing, but that messaging that goes out. And I think it's been very effective. You know, and it'll go everything from, you know, I choose education over alcohol. I choose music over marijuana. But, you know, there's so many things you can interact with that and play off of. So, but yeah, staying with a consistent message really does help.
Thank you very much, Rusty. And I wish I was out on that beach with you. I'm gonna tell you that right now.
Well, I wish I was there too.
You know, I want to say this when you're talking about messaging. I took a picture behind the, what's the people who, Mockler. I was behind a Mockler truck one time. And I took the picture because the message was drink responsibly. Well, I was behind the truck the other day and they've changed their message to enjoy responsibly.
Yeah.
And you know what you were saying, Carlton, is that we have to clarify the messages. We have to let people know what is invisible, because these people are creative. They have marketing people who are selling their products very creatively. And oftentimes we as prevention people don't have those resources available to us.
And they got money.
Right.
Right? They have money. But here's the major point that I wanted to offer. And I'll end with this. It just became so very important for me as I travel around the country to be able to share a conversation that would hopefully provoke folks to thinking about the way we speak about who we are and what we do. I don't know about many of you, but I can tell you many a Thanksgiving dinner that I've had with my family members where somebody asked me what it is that I do. And after spending about 25 minutes trying to explain and share with them, their eyes roll to the back of their heads and they just say, can you just please pass the gravy? And that's all I really want. That's all I really was asking, right? And part of what it is that I am sharing with us is that it is incumbent upon us, the onus is on us to be clearer about who we are, about what is it that we are attempting to do, and as Simon Sinek offered, the why we are doing that, right? To be able to engage folks in that kind of a conversation, because they are much more adept at doing it than we are. But what we have are the numbers. The reality is that there's more of us than there is of them. The reality is that the great majority of our young people are not using any substances. The reality is that we have a society that is the majority looking at how can we create and can make sure that our communities are healthier and safer. And if we can find a way of galvanizing that majority, we can counteract all the money that they put into the equation. We just have to raise the level of our state of play.
Look, I want to make one more comment and then I'm going to shut up. Okay. But I'm happy you said that. I was on a phone call with Dr. Leslie Freeman and the rest of them the other day. And I was saying to the people in the prevention field, this is our time.
Yeah.
You know, OBH has funded the LCPR. We have so many trainings so we can really get the factual information out to the people. I told them that this is, you know, I've been in prevention for years, and this is the first time we are at the place where we are to be able to get our message out all over this state. And so from now, you know, I know for years to come, we have this opportunity. So thank you again.
Thank you. So
And thank you all the prevention people who are out there and who are going to get fired up. Pastor Dale is on this thing. See, I'm sounding like the preacher. Okay. Prevention people need to get out there and spread the word.
You need to spread the word, Dr. Harris.
Yes.
I just want to say on that note, I want to jump spiritual for a minute. I think what you were saying was Isaiah 50:81, cry loud, spare not, lift up thy voice with like a trumpet and show my people their transgression in the house of Jacob their sin. So I like what you compliment on earlier about the invisible things, that exposing the invisible things are not seen, that
That's
making them
right.
aware that, hey, that this can hurt you. And I'm old school. I came up in 1965, and I listened to an old rapper called
together.
Cool Mo D, and he had a song named "Knowledge is King." So what you don't know can hurt you. What you don't know can hurt you. But we really enjoyed the webinar. We really enjoyed it, and thank God for each and every last one of you. And like I said, Dr. Harrison, it's our time. It's our time.
Okay, and next week is going to be for the faith base. So get some other ministers on the line next Friday.
Yes, ma'am.
all right. Well, as my grandma said, when there's no more to say, it's best to say no more. So I want to turn this back over to the hands. I want to thank you all very, very much. If you all can turn your cameras on for those who are willing to do so. You know, Paula wants to get her class shot. I appreciate that. I appreciate your time and attention, and for your enduring my technical difficulties. I completely apologize for that. That is not the way I like to roll, but I appreciate your endurance of it. Thank you very much. And I believe I'm going to turn this back over to Paula.
Yeah, but could you stay on for a little bit, Carlton?
Yes, ma'am.
Okay.
Thank you, everybody. I thank you, Carlton. Thank you, David. It's a pleasure every time to have a training with you guys. I just love it. You guys make my Friday, and I'm very, very happy. Thank you, everybody all over the state. I miss you guys. I miss travel all over the state with the Harrison, you know, and just riding and see. But this is great. I can see you guys. Thank God for the technology. Thank God that we can still meet and see each other and have fun and laugh. I miss you. But go to the website, see what we have to offer. We have a lot to offer. And I want to say thank you to Leslie. I really, really appreciate. I don't see Felicia today on the call, but Felicia has been great. Leslie's been great. Dr. Williams, the OBH supporting the LCPR has been great. And like the Harrison said, even though I miss being on the road, there is no times like this. We need to use this technology, get the message all over. And this is easy, is a change. We need to embrace this change, but I think we can still have our parties here online. We Louisiana people, when life gives us lemons, we boil crawfish. That's how we do. So saying that we are very resilient. Just contact the LCPR if you need anything, okay? Email me if you miss anything. I know that most of you guys are ready for your renewals. I'm getting a lot of emails. I'm trying to help you guys as much as I can so you get all your CUs and everything straight. So happy Friday. Enjoy your weekend. It's a long weekend. And just visit the LCPI website. And thank you, thank you, thank you.
Next week.
Dylan and Summer and Charmaine, Latasha, Charlotte. And
Dr.
good
Harrison.
to see you.
I had to work this
Eva.
morning.
Thank you.
Okay, Carlton, I'd like to
Hold on.
introduce you to Dr. Susan